Good afternoon. It's now been 15 months since the first case of COVID-19 was detected in Jersey. It's been 6 months since we began the most comprehensive vaccination programme ever carried out on Ireland. So 75% of islanders have received their first vaccination dose, and 59% of islanders over the age of 18 are now fully vaccinated with 2 doses. Our uptake continues to increase week on week. It has also been 3 months since an active COVID-19 case was last in the hospital. However, COVID-19 has not disappeared, and we will continue to see active cases in Jersey, and it does remain a threat if not detected and properly managed. But the threat is being managed through vaccination, through testing, through contact tracing, and through isolation, and we need to balance that threat with the ongoing risks to islanders' freedoms, to their mental health, and to our island economy. We also need to proportionately balance the good position of our vaccination programme and the reduced risk presented to those who are fully vaccinated when they are in contact with an active COVID-19 case. So yesterday evening, on the advice of STAC and public health officials, ministers agreed changes to our isolation policy for fully vaccinated direct contacts and to extend our COVID status certification scheme. Therefore, I'd like to confirm that with immediate effect, the isolation policy for fully vaccinated direct contacts is being changed. And I'll ask the Deputy Chief Minister, Senator Lyndon Farnham, and the Minister of Health and Social Services, Deputy Richard Renouf, to set out these changes in more detail. These steps are completely appropriate as we see increasing numbers of fully vaccinated islanders and as we move towards living with COVID-19 whilst ensuring our resilience of our health services and the safety of our most vulnerable. I'll now hand over to Deputy Lyndon Farnham. Senator Lyndon Farnham.
Senator, while we still have them. Yeah. Thank you, John, and good afternoon. Ministers agree that our response to COVID-19 must be proportionate to the risks we face and take into account the real impact on all islanders. Like many of my fellow ministers, I have been contacted over the past week or two by parents, business owners, visitors, and a wide range of islanders. They have all raised concerns about the current isolation requirements, particularly where they affect children and the fully vaccinated. And that is why I'm pleased that on the advice of STAC, we are able to announce a revised isolation policy for fully vaccinated islanders and visitors who are contact trace. The Health Minister will talk about children later, but I'd like to reassure islanders that that is a priority and we will be addressing that as well. Firstly, there will be a reduction in the isolation period for fully vaccinated direct contacts who are identified on island. From today, they will only have to isolate until a day 0 negative test result. They will then have to take further tests on day 5 and day 10. So that effectively eliminates all isolation for vaccinated persons. Fully vaccinated direct contacts identified while travelling to Jersey will no longer be required to isolate, but must undergo testing on day 0, 5 and 10. And these new measures will continue to protect islanders from the spread of COVID while reflecting the reduced risk that double vaccinated islanders face from the virus. Everyone aged 18 and over who is currently isolating will be contacted to explain the change. But if you are fully vaccinated and have had a negative test result while in isolation, there is no requirement to wait until you hear from them. From now, you no longer need to isolate. The changes announced today enable us to use the successful vaccination programme to protect those most at risk, but also to reconnect with each other and the rest of the world. There is also a clear pathway in place to remove the remaining restrictions we have all faced during the past year. And I look forward to the next stages of our COVID-19 reconnection plan. This will include the return of standing drinking and the reopening of all hospitality businesses, including nightclubs. Not to mention, of course, household gatherings. We will, of course, continue to monitor the prevalence of the virus in our community and the positive impact of the increasing number of vaccinated islanders and the protection that affords. From the first days of the pandemic, we have acted quickly to put in place financial support for businesses. We have adapted the schemes as the pandemic unfolded so that we could ensure islanders' jobs and livelihoods were protected. And we are going to continue to do this. We recognise there is ongoing pressure on certain business sectors that are still not able to operate as normal or have been affected by the extended travel restrictions. And we are committed and remain committed to continuing support where necessary. Current schemes are due to finish at the end of June, and we have asked officers to review the position and bring back proposals early next week, particularly for the worst affected sectors such as tourism, events and hospitality. We also want to ensure that as many public events as possible take place this summer, and officials are working closely with event organisers and their suppliers to ensure events can still take place in a safe and appropriately managed way. I am confident that we will see a safe, enjoyable summer ahead as things improve for islanders and visitors alike. Thank you. I'll now hand over to Richard, the Health Minister. Richard.
Thank you, Lyndon. We're acutely aware of the negative impact that isolation as a result of being a direct contact is having on some islanders, including detrimentally impacting their mental and physical well-being. So I welcome and support these decisions for fully vaccinated individuals. This includes a change meaning that fully vaccinated healthcare workers, identified as direct contacts, must now only isolate until a day 0 negative test results. They will then undergo daily PCR testing so that they can return to work in their frontline health and community care settings. As our vaccination programme continues, it's proportionate that we now afford more freedoms to those who have received maximum protection against the virus. I believe this new policy will be welcome news to many islanders. And I want to encourage all islanders over the age of 18 to book for their first vaccination. Everyone over this age is now able to book for their vaccination, as this is an important way to protect yourself and those around you. The changes we've made to reduce the isolation requirement for those who've been fully vaccinated reflects the reduced risk that these individuals posed to transmission. I absolutely recognise that this may be frustrating for those who have not yet been able to have their second dose of the vaccine, particularly, of course, younger people who have been further down in the JVCI vaccination priority groups. We're working as quickly as possible through all the age groups, but our supply is limited in Jersey to the quantities of the vaccine that we receive from the UK vaccination programme. And our vaccination rates are on a par with the UK's rollout. I would urge everyone who is yet to book their first vaccination appointment to do so as soon as possible. Currently, timings for second dose appointments are fluctuating due to vaccine availability. Some weeks the wait time for second doses is less, and other weeks it might be longer. However, we will ensure that you're vaccinated with a second dose before the 12-week mark, in practice well before. If you're expecting a second dose appointment, you will hear from the vaccination programme via text message or email with details of your appointment date and time. There's no need to call the helpline, as your appointment will be sent out as early as possible based on the vaccine supply we receive. Jersey's vaccination programme is world-leading, and we're in a very strong position to have offered full vaccination to all eligible islanders by the middle of August. And our COVID status certification scheme is also being rolled out successfully and at pace. Ministers made the commitment to islanders that everyone who received a second dose of the vaccine on or before 28th May would receive their COVID status certificates in the post in early June. We've maintained this commitment, and nearly 52,000 certifications have now been issued, so that islanders can prove they have been fully vaccinated. And as to children, as a government, we are committed to putting children first, and this has to be reflected in the way that we manage children and young people who are required to isolate as a result of being a direct contact. Following discussions and at the request of ministers, STAC is urgently progressing a review of evidence and policy on isolation for children and young people under the age of 18 who have been identified as direct contacts. We will hear from STAC, and ministers will make an announcement on the isolation requirement for children in the coming days. We're working closely with schools to improve on-site lateral flow testing, and will take steps to avoid children's education being unnecessarily disrupted. I'd like to take a moment to recognise the teams across health and community services and justice and home affairs who are working hard continuing to protect our community with essential pandemic response services. I especially want to highlight the COVID testing, Covert Safe and enforcement teams, and all those working on the COVID helpline. The work they do has become the day-to-day management of the pandemic, and we take for granted that they will provide the advice we need, arrange testing, and provide comprehensive results within hours. The sincere thanks of all of us go to them. But please help the teams by continuing to follow guidance. Please keep up the good hand hygiene, which should now be second nature to all of us. Complete contact tracing forms whenever you visit a restaurant or similar venue. And please try to keep a safe distance from those outside your household. These small but respectful actions are the changes we can make to mitigate the impact of COVID as we incorporate it into our day-to-day lives. Thank you, and I'll now hand back to the Chief Minister to sum up before we take questions.
Thanks, Richard. And I want to repeat your thanks to all the teams working in testing, vaccination, contact tracing, and across government on our COVID response. I'm also pleased to announce that we've made positive changes to the Covert Safe vaccination scheme. So fully vaccinated passengers who've received their COVID vaccine outside of the common travel area will soon also be able to benefit from Jersey's scheme. From Tuesday the 29th of June, fully vaccinated passengers arriving in Jersey who've received an MHRA approved vaccine anywhere in the world will be able to enter Jersey with what we call a green light status if they are coming from a green or amber travel area. And this means a day zero test on arrival and no isolation requirement. They can also enter Jersey as a green arrival if they have a red travel history, and this means a day zero test on arrival with isolation until their first negative test result, and a further test on day 8. Also, from Tuesday the 29th of June, individuals with evidence of vaccination from more than one jurisdiction will be able to use it as proof of vaccination for travel, and the pre-travel registration form will be amended to allow evidence of vaccination to be submitted from more than one jurisdiction. When we first set out our COVID management strategy, we said we were not pursuing elimination, but the protection of our most vulnerable and the safety of our health services, and we are continuing to do that. And whilst we are still seeing cases at the border and some in our community through close contacts, these are being detected and managed. Islanders are remaining vigilant, accessing the COVID helpline, being tested and having their results returned within hours. This is the reality of presently living with COVID and mitigating its risks. And the greater the proportion of our population that are vaccinated, the greater that risk is mitigated. Now, I completely understand islanders want their freedoms returned, and ministers are committed to the proportionate and permanent reconnection of our community. We will continue to look at the Stage 7 measures, which we have postponed until Monday the 5th of July at the earliest, and I look forward to addressing you again, hopefully soon, on our next steps. And I want to thank all islanders for your continued resilience, cooperation and positivity as we navigate our way to the new normal. It is in sight. And we'll now take questions from the media. Right. As I say, we've got a combination of online and in the room. So online we've got 103 and Bailiwick, and in the room we've got Channel, JP and BBC. So as I've written them down, we'll go for 103, which hopefully is Harry. I think you were rebranded onto the screen as I saw earlier, but anyway.
Oh, can you hear me okay?
Yep.
Brilliant, thank you very much. So can I start with children? You mentioned obviously that is being treated as a priority, but across the board, do you agree that it isn't proportionate to be having children, in and out of school, stuck in their bedrooms for 10 days, that is too much? And what options are being considered here? Because the Children's Commission has called for a pragmatic solution here. I think the UK are looking at possible, could we give PCR tests or tests to these children every day who are identified as direct contacts? What's being identified? And as I said before, do you accept that 10 days is not really acceptable for these children to be having to put up with?
The proportionality is critical, and I think this has been, in fact, as a general message, one of the things we've been going all the way through is about balance of risks. And we've talked about it, we've talked about lives, we've talked about livelihoods. The new variable, for want of a better expression, in that balance of risks is the state of play where we are on the vaccination programme. And obviously, so even if this feels slightly similar to where we were in November of last year, the new element is that, 59% of everybody is now fully vaccinated, or those over 18. So in terms of proportionality, we have asked STAC to consider that proportionality, and we're expecting them to come back to us in the next few days as to is there anything we can do. I do make the point. So obviously it's nothing new relatively. We had the issues, pre-Christmas and post-Christmas surround isolation. We have to bear in mind that for the sake of argument, if you've got 15,000 children out there, shall we say, and it's maybe between 1 and 200 who may be isolating, or since June may have been identified as a direct contact. We are talking to date quite small numbers, but that doesn't make it any easier for those individual families. So very, very sympathetic to those families, absolutely understand the position, but we've also got to make sure we do protect, in that context, the overall well-being, if you like, of the whole school population. And to date, we've managed really successfully to keep the schools open, and I think actually we've been about the best performing in the entire Common Travel Area or the entire United Kingdom. In other words, we've managed to keep the schools open the most, and that's incredibly important for the education of all our youngsters. But so to go back to that question, there are, I can't give you all the options. I think there are at least 4 or 5 we are stacked to look at, and they will be coming back to us in very, very quick form in the next few days. I don't know if Richard or Ivan, you want to make any comments, but I think that's probably all we can say.
It's a full answer, Chief Minister, but it's a difficult issue to deal with because we must remember children don't have the benefit of vaccination, and we must also be mindful of our duties to the thousands of children who are attending school, and we don't want them to be in a position where we have sickness spreading amongst many children. So, we absolutely are aware of the difficulties of asking children to isolate and the mental strain that involves. But we must also be conscious of the risks of children falling ill, and large numbers of them. So we are trying to find the right way to achieve that balance. And we've had lengthy discussions on it, but because of the complexities, STAC have yet to conclude their advice to us, and we're looking forward to that.
Yeah, and it is a priority. Let's be really clear. Ivan, do you want to add anything?
As COVID has always been an exercise, if you like, in the balance of risks. And as the severity of disease has decreased as a result of vaccination pushing infection into younger people who are less susceptible to severe disease, significantly so, then the weight of the NPIs, the relative weight of them in the equation has changed. And this is why we are looking at the balance between the isolation of direct contacts in schools versus the damage that is doing to individuals, whilst bearing in mind that isolation due to sickness is also damaging, as the ministers have said. So it is a complex equation and will be looked at in the next couple of days with a view to coming up with recommendations for ministers to decide upon early on next week, very early on next week.
Yeah. Do you want to do another question?
Yes, thank you very much for that. I just wanted to ask from a business perspective, if that's okay. Senator Farnham, in your opening remarks, you talked, I think you used the phrase proportionate to the risk we face, and you said you spoke to business owners about the difficulties that they had with, obviously, the isolation rules which you've set out today, but it's not just the isolation rules that have caused so much bother with so many businesses. I think many people will have seen the really heartfelt words of Tony Sargent, who runs Jersey Kitchen, obviously very critical of the government, and says that he's thinking of throwing the towel in. He's really finding it difficult to carry on, given the lack of support, as he puts it. He wants a proper rescue package, I think he explained in his remarks on social media. Can that be brought forward? Can there be extra support that is going to really help these businesses that are still having to face restrictions, even though you've talked about the high vaccine levels and the low level of cases and the fact that we still don't have anyone in hospital with COVID-19? And can you say that the 5th of July date, that we're not going to go any further than that, the 5th of July is the end? Because people, I think, are really struggling now or you're probably struggling to keep them on side. They're asking, why are we still going, given the high levels of people vaccinated and the fact there's no one in hospital?
Yeah, thank you, Harry. I think we've seen a big swing in public opinion on this in recent weeks, as islanders have become more greatly protected by vaccination. Everybody understands that we have significantly reduced risks. They also understand that we're never going to eliminate risk altogether. And I personally think we're at that stage, or very close to the stage, where we have to almost return to full normality. Notwithstanding that, Dr. Muscat and the team are still cautioning us that we're not quite out of the woods yet. The event sector has probably been the hardest hit sector throughout the pandemic, and we have put in place a range of business support measures to help them through this. It's been extremely difficult for them because in the event of Jersey Kitchen and other similar event companies, they were looking forward to coming out of this 2 or 3 weeks ago, but because of the prevalence of the Delta variant and situation in the UK, we've had to extend the restrictions slightly. At a meeting this afternoon, we asked officers to come back with firm proposals on extending the business support. They're going to come back to us early next week, and we'll be making an announcement exactly how we're going to do that. So I want to reassure businesses, those still being impacted by the pandemic, that continued support will be forthcoming.
I think if it helps, Harry, wherever we are in terms of when we finally do get out of doing the final release and restrictions, it's basically a matter of weeks. What I can't tell you is exactly how many weeks, but we all want it to be as soon as possible. There's no question there. The trade-off on this is what we've been talking about living with COVID, and obviously if there are specifics about the packages that we have put in place, then no doubt that Lyndon's been will be, if he hasn't been, is in touch with or has spoken to the individual you've mentioned. But and so as Lyndon was saying, we've asked officers to come back with specific proposals to us in as short a time frame as possible. So in relation to helping the businesses that have been really heavily hit by the restrictions that remain in place. Equally, the other matter we're just dealing with is, frankly, understanding the data from the UK in relation to the impact of the vaccination programme relative to the increase in the Delta variant that we've seen. And obviously that's the difficulty with the fact that the UK at present is projected or is listed on our sites as going red on next week, and that was particularly to allow people to adjust, because strictly speaking, that could have been done earlier. Let's put it that way round. But the issue is just fully understanding. Whilst we've done very, very well on everybody over 50, and then, as we said, 59% of the entire population over 18, that still does leave quite a significant number of people who have either not been vaccinated or only have had the single dose. And it's understanding the impact of the Delta variant on that cohort of people, which is still quite large in terms of thousands of people, and then making sure then how that translates through to hospitalisations. So to date, and I will hand over to Ivan, the message is good, but we want to be as certain as we can be, because we don't really want to be going backwards. We're trying to do a steady, careful reconnection all the way through. Don't forget, we've talked about the vaccination programme, but in terms of lack of restrictions, if you like, there are only very, very limited restrictions left. Yes, they are hugely inconvenient, more than inconvenient and distressing to a number of people, but relative to where we were even 3 or 4 months ago, we have moved forward a lot. And what we want to make sure that as we see those numbers go up, that actually our overall objective of making sure we don't get overwhelmed is still capable of, is still holding in there. Now I know, so we've been told that, for example, the messaging is that hospitalisation rates are significantly reduced, but that isn't zero. So it's just understanding the impact of that, and that's, I think we need a few more days. We have obviously task stack to coming back that with the certainty. Part of that is seeing really what happened in Bolton, and the time, using Bolton as an example, but the time lag thereafter, which over which it then translates into hospitalisation rates. Ivan, have I misrepresented anything there? But
no, not at all.
Okay, that's right.
So the numbers, of course, completely support what the Chief Minister is saying. The hospitalisation rates in the second wave were of the order of 15% in the UK, and have now dropped to less than 5%, which is very encouraging. 5% isn't 0%, of course, but it is a significant improvement. Additionally, those people who are hospitalised in the UK at the moment have less severe disease. Obviously, disease severe enough to take them to hospital, but they are less sick in hospital. The proportion of hospitalized individuals who used to go into ITU in the past was of the order of 25% or thereabouts, but currently only about 1 in 1,000 admissions are ventilated, which is a significant change. People are in ITU for with COVID for other forms of support, but not in the main ventilation. Obviously, more and more data will be accruing in the UK as cases increase in numbers, and that will further refine our data. But the data so far is encouraging, and it all points very strongly to the benefits of vaccination. So during one snapshot of what was going on in the UK, of the 120 cases that were in hospital, only about 10 of those cases had full vaccination. The others were not fully vaccinated, either because they didn't have any vaccine at all, or because they had only received one vaccine at that point. Or 2 weeks had not elapsed. So vaccination has completely changed the complexion of COVID and the significance of COVID infection. It hasn't ablated it, it hasn't changed it into a nothingness. It is still there, and we still need to be very careful, but it is starting to change. It has started to change what we think about what COVID numbers actually mean. And that is the way we have to start thinking, which is why the relative weight of NPIs has now changed, and which is why we are taking the actions that we're taking at the moment.
So, very long answer, but I hope that gives you the difficulties we're trying to deal with, and I'll add to the length of the answer, I'm afraid. Whenever we've been, having been there before now, at least twice I think, when we've been coming out of waves, if you like, when we've been trying to ease things up, there have always been anomalies, because we've had to make decisions about what one prioritises versus what one doesn't prioritise. And obviously at that very last stage, the last stages remaining are those that are deemed to be the most risky. And before we actually release those, that's why we just need to understand, obviously, the more risk you're putting out, you're accepting there will be more seeding into the community as a whole. And that's just that balance of risk we want to take into account, because we really want to try and make sure, if remotely possible, that when this is released, that's, as far as we can see, that is it. And we're then in that territory of then living with COVID and just going forward in that way. We really don't want to try and avoid going backwards in any shape or form, because that could cause even more harm. Anyway, that's definitely enough in that sort of territory, I think. Going down mine, I'll go to Channel next, isn't? We've probably answered all your questions, hopefully.
We've asked a few times about a little bit of information behind the numbers as the numbers have been going up. Particularly, we've been asking about vaccination status and age ranges of the people who have tested positive. We've been told time and time again you can't release the information for data protection concerns. I asked the Data Commissioner's office today, and they said there was no reason why you couldn't release on such a broad basis a little bit more about the demographic of people who are testing positive. I mean, even just in terms of giving people some assurance in terms of the efficacy of the vaccine, there must be some information that you can give us about the positive cases.
I think I'll hand that one straight across to Ivan.
Okay, thank you.
If that's okay.
It is the statistics in relation to the question simply reflect what we've been saying, which is good news. So of the 81 active cases reported today, 58 are of the aged between 10 and 29. So the bulk of them are in that age group. And of those, of the 81 active cases, 57 have not had any vaccination, 13 have had one vaccine, 3 have had 2 vaccines but less than 2 weeks, the second one being less than 2 weeks before exposure, so not fully effective, and only 8 of the 81 have had 2 doses plus 2 weeks since their last dose before exposure. So only 10% of all the cases we currently have had full vaccination, which compares with the 59% of individuals who we know are fully vaccinated. So there are a small proportion of those that have been infected. So vaccination is very much doing its job.
Thank you. Secondly, then, in terms of community transmission, we've talked a lot about that before as well, in terms of it having been from known source so far. 81, I think you said today, are those numbers still from a known source, or are we now in a territory of unknown source as well?
The numbers that I'm aware of, which do not include all the 81, have all had a source. But with time, it is anticipated that some will not have a source, but the significance of infection would still be the same, because infection has been pushed into the younger age group, and because COVID is invariably less severe the younger you are, then the disease, the consequence of infection in those age groups, irrespective of whether we know what the source is or not, will be much less than what it used to be when in the past, when we had COVID. In those elderly groups and those at risk, we had significant and serious disease. They are now protected by vaccination, and as the program rolls out further, the younger population will be further protected too.
Thank you.
If it helps, one step, I think it was more about patient privacy rather than strictly data protection, but it's not hugely different. There are, I'm just checking the numbers add up to what Ivan's just given, so 46, 51, 61. Anyway, broadly speaking, the bulk of the active cases as of the 23rd are from contact tracing and arrival screening. it's broadly a 50-50 split. There is a balance left, which is from some seeking healthcare. That's smaller. Right. Well, James is in the right order as well. Good.
We've mentioned, obviously, nightclubs, summer events, and as the majority of the at-risk population has been fully vaccinated, I wonder if there will come a point where we can lift restrictions for younger islanders who perhaps have only had one jab.
That's, I think, the overall principle of what restrictions we can lift. That's still what we're saying is in that kind of next stage of stack deliberations. So the easing of the completion of stage 7 is the opening of the nightclubs, is the stand-up drinking, and is the household mixing. Well, the greater household mixing than what we presently got. It is, and I know sometimes it's difficult for people to understand, the really simplistic way of putting it, and if we go there we can give you more detail, but is what we call a controlled event, which is when there's people who are external to the people who are meeting, who can keep an eye on what's going on. You've got hand sanitizer everywhere. There is some, usually it's about seated down service. So essentially the risk profiles that come through, which Ivan and Richard can only talk more to, is the risk of significant spread has been in, particularly nightclubs, has been, well, that's what we're told anyway, is nightclubs, is what we call stand-up drinking in the pubs. It's very difficult, it's more mingling, it's people not respecting distance, and you don't have that control over the contact tracing side. And as we said earlier, one of the areas where we had some difficulty a few weeks ago was a gap in some of the contact tracing information that we had, which did slow things down. And unfortunately, that's the informal areas of people in their own homes is one of those risky areas. But we're also acutely aware of the whole issues around human rights and all that sort of stuff, and that we keep balancing that all the time. It's really, really difficult. Okay. Next question.
And then secondly, obviously we've mentioned already the impressive strides made by our vaccination team up at Fort Regent, headed by Becky there, and it certainly has sort of exponentially made an effect to how close we get to that end goal. And I wonder how close we are to reaching herd immunity at this stage. Perhaps more a medical question, I suppose. But.
That's definitely for the gentleman down on the end, I think. Ivan.
So I think herd immunity is probably not going to be achieved by vaccination alone, given the transmission potential of Delta. But what is important is that we are moving closer to less severe disease all the time. And if the significance of infection is seriously attenuated, then we will have achieved our primary goal. Additionally, if as a result of protection of the vulnerable, there is still some degree of circulation of virus but not causing damage, then there will be continual stimulation of the immune systems of individuals, which will continue to protect individuals as we go forward, over and above the plans for boosting doses of COVID vaccine as we go forward. And we are in the throes of planning those boosting doses for this coming September, October.
Thank you.
Right, thanks. Bailiwick, Fiona.
Thank you very much for that. I just want to try and draw together a lot of the strands that we've talked about so far this afternoon. I mean, obviously, these very positive announcements on loosening restrictions and how vaccination appears to be doing its job. They're brilliant. And from what you will appear to be saying, it sounds like we're nearing the finish line in our battle with COVID. Dr. Muscat, you've expressed that it's your view we're not quite out of the woods yet. Just to be really clear, I mean, what are the last hurdles we'll have to clear before STAC will feel comfortable to recommend that we all live with the virus and make dealing with COVID a matter of personal responsibility and risk assessment rather than government intervention?
The problem with that question is that, or rather with the answer to that question, I should say, is that the virus isn't static. It moves, it mutates, and it changes. And whilst we know that we are dealing with the Delta variant, the experience of, we're not abrogating the Delta variant, we are managing it, and its significance has changed as a result of vaccination. There will be new mutations coming along, invariably, because that is the nature of the virus. And so with further developments in vaccination, which cover variants as we go along, and other measures, like in particular the availability of treatment. So the four pillars for managing vaccine, or for managing infection, diagnosis, infection control or NPIs, vaccination, they're in hand, but the fourth pillar, treatment, is not yet available to us. Once that becomes available, and there are drugs in the phase 3 trials at the moment, then we will be in an even stronger position to manage it and to relegate COVID to a background infection. But we do need to be vigilant. We just don't know enough about the virus to say we can now sit back and relax.
I think it's worth making the comment. I think you used the word finish line there. I think we're in the middle of quite a long either marathon or triathlon, I'm not too sure, but there's a whole range of stages in this. And we're not, although for us, for Jersey, we are close to what we're calling the end of stage 7 reconnection. That is a matter of weeks away. We just can't tell exactly how many yet. Don't forget, there are other parts of the world who are still having significant problems, and it is a global problem. And that is part of the thinking. That can raise the risk of mutation, all that type of stuff. But as we say, hopefully, from our small part of the world, with the UK as our neighbours, we'll be in a good place very, very soon. Europe is slightly behind us, but obviously they will be improving, hopefully. But equally, the living with COVID, we're putting the budget together at the moment, and we've got to think about what are the ongoing things. So there's likely to be a continued vaccination program coming through, boosters, all those type of things, which is then going to the other stages I think that Ivan is talking about. We've got to consider what's the situation going to be around how long do you continue testing people coming in, and the tracing side. So let's not kid ourselves that actually when we come into and we can go to the nightclub, then that's it. We hopefully will be in a very good place. The rest of the world has a long way to go. That it could be another year, and that's me as a guess. Okay, it's not another couple of months, and therefore, what measures do we have to have in place during that period to continue to protect islanders in the best way we can? So just to give you a flavour. So optimistic. We've done really well. We're doing well. Please hold the faith, type of thing, and we will be there shortly. The more reality thing is this is still around, and we've got to live with it, and that I think is the transition phase we're moving into. Do you want to go for your other question?
Yes, what you mentioned there regarding testing, that leads me neatly on to my next question. In the latest stack minutes, we saw that a £36 charge for tests was being discussed at the beginning of this year, and that a platform that would allow for the charging of tests was being built. We know that the current border testing programme that runs until December. Are you intending to introduce charges after that point or sooner than that?
Right. My overall position, that's as of today, these things can always change, is that at some point we will be bringing charging in. What we've got to be really, really careful about, we know that hospitality, for example, and the airline side is in a very fragile place. And what you do not want to do is bring it in at any point where it's going to essentially damage our economic position / competitive position, given a very fragile global environment they're in. So that's why we can say I think we're going to have to do charging at some point. I think I can't tell you when, and it will be to see what other jurisdictions around us are doing. I think the other point, what we have done, as you said about building a platform, we've put the investment in for a couple of reasons, but one of those factors is that when it goes live, and I'm going to look at Ivan and say I think it's July, isn't it, that we're aiming to go
end of July
live in. the cost of the overall cost should be significantly lower than what we're dealing with at the moment. And of course, then if you're then in that territory, that hopefully it'll be less than the £36 you mentioned, but I don't want to get into a number at this stage. As an accountant, I want to make sure that all the costs are covered, not just these little bits. That hopefully once that cost comes down to something that's actually reasonably manageable, and then it becomes viable to put that charging in, as opposed to, if you're charging a family whatever it is, £300, £600 or something, depending how many people travelling, that to me is rather significant. It also then comes down to as well is what's the balance of reasonableness and what volumes we're having to deal with.
What kind of figure do you see as being reasonable?
I think I want to know what the costs are first when we're dealing with it. Right. Finally, on this round, Julie, BBC.
Senator, I know we're nearing the end of the school year, but can you give me any indication of when guidance on school bubbles may end?
At this stage, probably not. I think the main reason that is, as we know, we are seeing some numbers going up in the schools, and I think we just really want to understand what that position looks like. We haven't got that long to get to till the end of term, and I think the most important thing we can do in the light of, as we said, the increasing numbers, is get as many children to the end of term in the best way possible, and that's for their education. And that's got to be the overarching principle.
Can I urge all children who are
Yeah.
eligible to take part in the lateral flow testing?
Absolutely.
That will be a great help to monitor what is happening in the schools and limit the spread of any infection there.
Because it's not just for them; it's for all their friends and all their colleagues in their classes, all their classmates. If they get a test and their classmates get tests, it does help protect all of them and the rest of the school. Another question?
Yes, certainly a lot of young people in their late teens, early 20s feel that they've made a lot of sacrifices over the last 12, 15 months. What would you say to reassure them? Because again, they're being asked to make a lot of sacrifices. Many of them haven't even had their first jab yet, and yet their freedoms are being severely restricted. So what would you say to them?
Absolutely recognise that. I mean, obviously, everybody's freedoms have suffered in some shape or form during the last 15 months. I also accept that we've had to do priorities according to the advice around how the vaccination programme is run. That's absolutely driven by the fact that the older the person is, the more and greatest impact the virus has on that individual. So so if you're 18 or if you're 20, our understanding in the main, the impact is significantly less than it might be on their parents or on their grandparents. But we are coming towards the end of that. It's hang in there. You can, if you're over 18, sign up and get your vaccine, your first vaccine now. Some people are obviously already doing it. The more we can encourage you to get in, get the booking done, the closer and the quicker we can come to getting out of this particular stage.
Okay, and can I ask just one more quick question?
So that'll be your third question. We'll go on the others, but yes, that's okay.
I have been contacted by people who are wondering, are there any exemptions to the vaccine? People perhaps who've had an acute reaction to the first vaccine. Are there any exemptions, or is this just something that, because some people are feeling, why should they have to have this vaccine if it means they want to travel?
I'll go to Ivan on that and then come back to that.
So the current emphasis, of course, is on vaccinating as many people as possible as soon as possible. But in so doing, we recognise that in some cases it may not be possible to vaccinate for medical reasons, and we do need to now start thinking about what position these individuals are in and how to manage that. They will be protected, of course, by the vaccinated people around them, and that is one of the factors that we will need to take into account when making decisions. But we cannot speak for other countries at the moment in terms of, if you are not vaccinated, you will have these restrictions if you come into our country. That is something for those other countries to determine. But we do need to address it, and now we're coming to that point we haven't addressed it fully yet.
Okay. We'll do one final question each. So we'll go 103, Channel, JP, and Bailiwick, and BBC have already got ahead of you. So 103, Harry, final question.
Yeah, thank you. On the next stage of reconnection, given what we've talked about and the risk, the uncertainty still there, is the 5th of July for the next stage of reconnection still possible, or is it possible that, or likely that it may extend further than that?
I think at this stage we can't tell. We know we said I think we'd do a review early next week, and we'd announce, I think it's next Thursday, and I don't want to preempt that because it's very much a case of just seeing where we're going over these next few days. Okay. Listen, Channel.
There's a fair amount, I'd say, concern around vaccination of under 18s. Where are we now in terms of the research on that and our position, I suppose?
So there has been a lot of deliberation and discussion in JCVI and amongst public health officials in the UK. And really the only sensible approach is to await their official recommendation rather than try to second guess them or try to anticipate what they might say. We expect the recommendation to be announced this week, but even that I can't be sure of. So the sensible thing is to really wait for the recommendation.
Okay, James.
I apologise if this one's already been touched on, but given that the changes we've announced today obviously have quite a few implications in terms of, people leaving isolation, and I wonder how easily something like that can be reversed, and if you envisage that perhaps these changes could be reversed. When you say reversed, do you mean in terms if somebody's if you've got X hundred in isolation now, how easy it is for them to come out of isolation? That's right. Well, we hope by making the announcement and effectively saying that essentially if you've been double vaccinated and you've passed your 14 days, that actually you no longer, and provided you're feeling well, by the way, you no longer need to isolate. Hopefully that message goes through. But my understanding is that logistically there will be some arrangements in place that basically between now and hopefully the weekend they will all be contacted. That's my understanding of the position. I think Richard or Ivan, do you want to comment on that? That's our understanding.
Yeah, that is the case. The teams will be in touch with all people who have currently been asked to isolate.
But John, could I just to be clear, if you are in isolation now and you are double vaccinated and you have received a negative test since being in isolation, you no longer have to be in isolation. Your freedom, if you like, can be returned immediately. You don't have to stay in isolation. I think it's really important. It's important for us not to detain people in isolation when we don't have to. So that's just to make that clear.
And I think that was the crucial thing. We also try and do on those particular slides, absolutely on the stack advice, and we just need to run that through. When we announced the changes last week, we did say we were going to stack in relation to this area, and obviously stack have now come back. But Lyndon's absolutely right. This is it's a fundamental one, and we're very pleased with where we are. Thank you. Okay, and finally, I think Fiona on Bailiwick, who may have frozen. Oh no, that's okay.
Hello?
Yes, we can hear you.
So just as a final question, perhaps this is one for the Economic Development Minister. We know that there's around 20.4 million left in the fiscal stimulus fund, the money put to get the economy going again. The Treasury Minister says her department might not have the time or resource to consider any more applications from local organisations. So what would you like to see done with this money? I know the idea of another innovation fund has been thrown around, for example. So what alternative uses would you like to see with that?
So just to be clear, there isn't 20 or 24 million left in the fund. That's 20 or 24 million less we would have to borrow. So there's a subtle difference there. And I think given the financial challenges we're facing coming out of the pandemic, it's unwise to borrow without having a really good idea what you want to borrow for. And there are a lot of ideas going round at the moment. So I would urge caution on that. We are putting together the future economy plan, the economic framework, and there will be certainly no shortage of investment opportunities for the government to restart the economy. But it's not 20 or 24 million left in the pot, it's 20 or 24 million less we would have to borrow.
That's the most prudent answer you will hear from the Minister for Economic Development for a very long time. But no, I do agree with him. I have to say, I think we've all got areas where we think there could be improvement. I'm quite keen on getting some more money into regeneration for St Helier. I'd like to see some more money into the what I call softer wellbeing areas, and I'd very much like to see some more money going to tech. There may be other ways of doing that, and you might hear more of that later. But I think Lyndon's right, actually. We've got to keep focus about what we'd love to do and the nice-to-haves, and the fundamentals are the more we add onto the bottom line, the more ultimately we're borrowing, and we are trying to get that balance between supporting everybody that we have done and I'll use the word, a prudent financial outcome in the context of the amount that we've had to actually borrow and spend to get the island to where we are today.
Just very quickly, can you just confirm at this point in time how much has been borrowed from that big super duper overdraft that was taken out of 500 million?
I'd rather not give you the exact figure right now because we've been talking and it's been fluctuating a little bit, and so I might give you the wrong figure. What I can tell you is that it is not as much, significantly not as much as we were originally projecting, and I'm talking tens of millions of pounds lower, not £1 million lower. But we can give you some further information, I think, from Treasury on that line. That is as we said when the accounts came out, not only have our reserves gone up, even in the context of everything we've done, the income forecasts have come out better than was originally done. This was for 2020, and we haven't spent as much. So overall, as much as we were projecting. So overall, the financial position is better than we were projecting, and that has a whole range of positive outcomes. What we're obviously looking at now is what we can project for 2021 and 2022, and also in the context of there's a lot of capitals projects and things that people would like to spend money on. The challenge that's happening at the moment for a number of us as ministers is we are challenging we as the non-spending ministers, I would put it that way around with my tongue slightly in cheek, are trying to challenge those who have the propensity to spend money and say, do we need, or portfolios that have the propensity to spend lots of money, do we need to spend that in the context of the financial position we're in and in the context of there is further uncertainty come, we all know that, but to date we're in a really good position to address that. Okay. Right, I think on that note, I'll do a couple of words just to sum up, but thank you everybody for listening. And thank you to the media for joining us this afternoon. But what I do just want to run through is, sorry, I shall go back, because otherwise I was about to repeat the words that I actually had for earlier. But we are, as I was saying, we are in an increasingly strong position as we head into summer, not only financially, but also from the point of view of dealing with COVID. And we've been able to take decisions like these ones today because of the continued support for the vaccination programme. But now is not the time to lose momentum or the good habits we've all got into the habit of doing and we've all followed over the last weeks and months. If we continue to work together, maintain best practice, follow track and trace procedures, and take up the opportunity for vaccination as soon as possible, then we can enjoy a summer of freedom and a summer of safety. Thank you very much. Thank you everybody for listening online. Thank you to media, and let's draw this press conference to a close.